I'm now going to demonstrate how to use the driver to perform a bone marrow biopsy. Before you start the procedure, you always want to make sure that you have enough battery left in your driver. So you always test it, just to make sure. There is a light at the back of the driver that will be green to show you that your battery is full. It turns to an orangey yellow colour and then red when there's no battery left in the driver and you need to change it. It has a shield that comes with it to protect the driver at all times. Once your patient has been positioned on the bed, knees to chest, you will have searched for the appropriate landmarks to find the spot where you want to go in to perform your bone marrow. The area will be numbed, ready for the procedure to take place. Whilst you're waiting for your lidocaine to work, you will prepare your equipment ready for the bone marrow driver. Each procedure has a brand new package of equipment per patient. Unwrap the outer paper, take off the inner top sheet, take off the cap for your driver and place the driver within the plastic bag in the centre of the pack. This area is now sterile. You remove yourself from the drill, you would need to change your gloves and put on sterile gloves for the remainder of the procedure. Take the two blue plastic pieces on the sides of the bag and drag them over so the bag is covering the driver completely. Unroll the top of the bag, and here there is a piece of paper that hides a sticky layer. Roll the top of the bag over the sticky layer, keep it nice and firm and tight, and bring in the edges, the two blue pieces together, and you can twist them to ensure the driver is nicely positioned within the bag. And this is now sterile for you to use. Place it upon your sterile field. Inside the pack is the white connector that will go onto the end of your needle when you're removing your sample from the trephine. The piece of equipment that will help you to remove the trephine sample from your driver needle. And this is the actual needle that you're going to attach to your driver to perform the biopsy. As you can see, this needle has centimetre markings to help guide you when you're taking your sample. There is a plastic piece here that moves up and down the needle so you can fix it at 1 centimetre, 2 centimetres, however long you want your sample to be as a guide. When you unscrew the needle, you can remove the inner sharp pointed needle that you're going to use to get into the bone. The remaining needle is hollow. When you're taking your sample, you take out the pointed needle and you attach your syringe and get your aspirate out from the hollow needle. Make sure before you start the procedure that this inner needle is tightly positioned within the hollow needle. The driver and the biopsy needle are connected by simply placing the orange part into the part here of the driver, and you'll hear a click when it's in position. If you want to test that it's okay and that it's not loose before you start to use it, place your finger on the trigger and just give it a small push. When you go to your patient, we recommend that you don't put your trigger finger constantly over the trigger. Remove it to the side because we don't want to accidentally be pressing the trigger as you're trying to find your way through the skin to the piece of bone. Go to your patient. You know where you're going to go, you have your landmark and what you're going to aim for. This is the posterior iliac crest. You're aiming for this part of the bone here. On our demonstration block, the top layer represents the cortex of the bone. Your needle is now against it. Once you're sure that you're in the right place, you can now put your finger onto the trigger and you're going to, with a steady pressure, push the driver through the cortex into the aspirate. You will feel a give as you move from the hard cortex into the softer, more spongy tissue of the marrow. Warn the patient that they're going to hear the whirring noise of the driver. At this point, remove your finger from the trigger. You can now remove, by pulling back on this black piece, the driver from your needle. Place the driver to one side, unscrew the inner needle from inside. You would now attach your syringe and you would pull back to get your aspirate sample from the marrow. Use the aspirate sample to do your slides. If you need further samples of aspirate, you would then attach another syringe and pull out more liquid sample from the needle. Once you have sufficient samples, you don't need to introduce the needle back in. You're now going to get your Trefine sample from the patient. Reattach your driver to the top of the needle. It's nice and secure. Again, don't attach it with your finger over the trigger because you don't want to be spinning the driver whilst you're trying to attach the needle. You have an indicator piece on here, and alongside the needle there are markings that are a centimetre apiece. You can move this marker down to make sure that you're getting the right amount of sample from your patient. When you're getting your Trefine sample, it needs to be a smooth movement, not stop, start, stop, start. So prepare your patient again by telling them they're going to feel a little bit of pressure and also that they're going to hear the noise again as you go in. And then in a smooth movement, you go down to the top of your marker and back out again. Your needle is now out from your patient. You can release the needle onto your surface. Take your white plastic piece and place it over the end of the hollow needle. Take your blunt needle, place it into the white plastic and give it a sharp tap to help release the piece of bone that's inside the sample, and then just push gently down, and there is your piece of Trefine bone that you now put into your Trefine specimen pot and that you will then send off to the lab. There's no needle in the patient anymore. You can clean the area, make sure there's no bleeding, and apply a dressing. The biopsy procedure is now complete. You fill in your samples and all your paperwork that you need to do, and before the patient goes, you will check that they're okay and there's no bleeding, bruising or pain anywhere. The patient can be discharged, and then you would then collect all your equipment, remove the packaging from the bone marrow driver, and that can all be disposed of, and you keep your driver for the next procedure.